Has your dog ever frozen in front of a door, as if something invisible frightens him? He doesn't want to go in. He doesn't want to go out. He stares at the floor, hesitates, backs away, or simply freezes. Many owners believe it's stubbornness, senseless, fear, or even manipulation. But today you're going to discover something rarely discussed these days, even by veterinarians: doorway and hallway blocking syndrome in dogs. And no, it's not always related to trauma. Some dogs develop it due to stress, a bad experience, visual problems, anxiety, or even physical pain. Stay until the end because I'll teach you how to identify the true cause and how to help your dog without making the problem worse. What's really going on? Doors are transition zones. For us, they're normal. But for some dogs, they represent a point of uncertainty. Think about this. A door changes sounds, smells, lighting, and space. And some dogs are extremely sensitive to these changes. For example, a rescued dog might associate a door with abandonment. A puppy might have slipped once and develop a fear of the floor. An older dog might have joint pain and be afraid to cross smooth surfaces. Even some dogs with anxiety feel insecure when moving from a safe space to an unfamiliar one. The strangest thing is that many owners worsen the problem without realizing it. They pull on the leash. They push them. They yell at them, or they pick them up quickly. And the dog learns. Doors are places where I feel the worst. Signs that almost no one notices. There are very subtle signs that indicate your dog might be developing this problem. For example, lowers its head before crossing, licks its nose repeatedly, looks behind it, searching for an escape route. He walks close to the wall. He avoids certain rooms. He freezes right in the doorway. He runs across the street as if he wants to escape quickly. Many believe this is just a quirk. But in veterinary behavior, these behaviors can be early signs of contextual anxiety. Some dogs even develop a specific fear of the following: shiny floors, sudden changes in light, metallic sounds, drafts, or automatic doors. And here's something important. If the problem appeared suddenly in an adult dog, you should consider a veterinary checkup. Because pain, vision loss, or neurological problems can also cause this behavior. How to help your dog correctly? The solution is not to force him. In fact, forcing him usually worsens the fear. The right thing to do is to rebuild trust step by step. Here's a simple and effective method. First, never pull on the leash in front of the door. Stay calm and wait. Second, place treats near the doorframe, not on the other side. The idea is for the dog to associate the area with something positive. Third, if the floor is slippery, use rugs or non-slip surfaces. Many dogs stop freezing as soon as they regain their footing. Fourth, don't use an exaggeratedly worried tone of voice. When we say, "What happened? What's wrong? Poor thing," some dogs interpret this as meaning something is really wrong. Fifth, practice short, calm walks several times a day. No pressure, no rush, no punishment, and something very important: celebrate any small progress. If today he took one more step than yesterday, that's already progress. Conclusion: many strange behaviors in dogs have explanations that often go unnoticed. And when we learn to observe more closely, we understand that the dog is trying to communicate something. Sometimes fear, sometimes pain, sometimes insecurity. So the next time your dog hesitates in front of a door, don't immediately think about obedience. Think about what he might be feeling. Because understanding a dog will always be more powerful than simply controlling him. If you enjoy these kinds of lesser-known topics about canine behavior and health, subscribe to the channel. And tell me in the comments, does your dog have any unusual behaviors that no one can explain? Perhaps it will be featured in the next video.